Hey everyone, it's Shasta Zeman here. I'm a nurse practitioner from Saskatoon, Saskatchewan, Canada, and the owner of Unmask and Evolve Holistic Health and Wellness. And today I want to come on and do a video because I am absolutely dumbfounded by this morning's news. And I felt really compelled to come on and do a video about some of the information that's out there about potential treatment options for COVID-19 and how dangerous this information is. So the first thing that I want to talk about is there's been a lot of information out there based on a comment that the French Prime Minister had made about using non-steroidal anti-inflammatory drugs. So things like ibuprofen or Advil or naproxen, Aleve, saying that we shouldn't be using these drugs. These drugs are commonly used for pain and for treatment of fever. There is not sufficient evidence to say that we should be avoiding these drugs in patients who have COVID-19. Okay, so it's safe to use these drugs. The World Health Organization has promoted that, has put out ads. You'll see if you follow me on Facebook at Unmask and Evolve or on Instagram at Unmask and Evolve, you'll see that I've posted about this. So, non-steroidal anti-inflammatory drugs like Advil, ibuprofen, naproxen, Aleve, these things are safe. Okay, so that's the first thing that I want to say. The second thing that I want to talk about is a video clip or an audio clip that I received from a couple of you from a doctor in Spain who had gotten some information from a doctor in China about ways to prevent the catching or getting COVID-19. And one of the recommendations that this physician made was drinking hot water or hot beverages like coffee and tea every 20 minutes and avoiding cold fluids. This certainly hydration is incredibly important to keep us well. This is not going to prevent you from getting COVID-19, okay? And so we do not want to be giving people false hope in regards to this. So certainly hydration is very important. They also talk about eating lots of fruits and vegetables, also very important. It's important that we're eating well, we're drinking a lot of fluids, we're managing our stress, we're sleeping well, we're getting some physical movement in our day. These are all things that are incredibly important to primary prevention for a variety of things. But these specific, recommendations are not bounded in science, and we really need to be careful about that. The other thing that this person had suggested was gargling with an antiseptic, something like salt water or vinegar. Certainly salt water rinses of your mouth are not going to harm you. However, I'm quite concerned about people being suggested or told to gargle with vinegar or any type of severely acidic fluid, because that will take the enamel off your teeth and cause problems with your oral health. We really want to be careful with that. Certainly we want good oral health, right? Brushing our teeth, doing all of those things, but gargling with an antiseptic, we don't have evidence to say that is going to prevent you from getting sick or prevent the severity of the illness. In this video, what was helpful was just saying, regularly washing your clothes, bathing regularly, especially if you're going out, washing the surfaces in your home, washing your hands regularly. This is all really important, okay? That information in this audio clip was very good. The other thing that they talked about was don't smoke. Certainly smoking, for anyone who has any respiratory illness, it certainly increases your risk of any type of flu. I also recognize that quitting smoking is not something that's easy to do. It's an addiction. But it is something, if you feel that you're capable of doing it, to do. The other thing that absolutely floored me this morning as I watched the morning news was that the US, specifically Trump, is claiming that anti-malarial drugs will treat COVID-19. There is no evidence for this. There was one study on 6 patients that had potentially some benefit. This is not enough for us to determine that this drug could be of help. And with this, people are now going out, buying these medications online, taking them, hoarding these medications. This is really dangerous. So the 2 medications are chloroquine and hydroxyquine. These drugs are used in patients with lupus or rheumatoid arthritis. They need these medications to keep their symptoms at bay. We really can't be using these medications in a way that has not been scientifically proven. Okay, the other thing is that people are buying chloroquine off the internet because it is used in fish tanks to prevent algae, and they're ingesting it. So there was a case in the States where somebody had bought this stuff online from a pet store and started ingesting it and died. So we really need to be careful. When we find a treatment for this, we will all be aware. The World Health Organization is starting a rigorous study about these medications. Canada is investing in research. They've invested in both prevention, so they've invested heavily in vaccine development here in Saskatchewan, which is amazing. We have one of the best vaccine development teams in the world. They're also investing in a company in Quebec for that. They're investing in potential treatments in a company out of BC. Once these things have been tested, once we know the safety profile of these things, we will all know, and I will report back. Be very careful about the media that you're ingesting. When we're in a fear-like state and we're looking for answers, we're going to be willing to grab onto anything for hope. And I really hope that you're reaching out to the healthcare providers in your life. You're looking at, watching and getting news from reputable sources, because this could cause such a dangerous backlash. Okay, so be safe out there. Once I have the right information, I will be sending it to you. Okay, take care. Have a great Tuesday. Bye.